Yesterday was World Polio Day, but it's never too late to take part in the global and urgent call to make polio history. The World Health Organization says the Philippines is still considered at risk for polio outbreaks. So how do we stop this from happening? Joining us this morning is UNICEF Philippines immunization specialist, Dr. Carla Ante-Orozco. Good morning, Doc, and welcome to New Day.
Morning, Paula. Thank you for having me again.
All right, always a pleasure to have you, Doc. Let's take an overview here. Let's zoom out a little bit. How vulnerable is the Philippines for polio outbreaks? I think a lot of people, myself included, have the opinion that, or we think that polio is largely eradicated, but it does rear its ugly head every so often.
Yes, we want to inform everyone that the Philippines is still at risk for a possible polio outbreak, with 24 out of the 81 provinces still at high risk. Although this is lower from the previous year's assessment, but still the Philippines is not out of the woods yet. There are still many children that are unvaccinated and under-vaccinated from polio and even other vaccines during the pandemic years.
Right.
So this is really an urgent call to make polio history, as they say, and also an urgent call for catch-up vaccination efforts and sustaining those efforts to improve polio vaccination coverage.
All right. Well, obviously, vaccination would be the key here, but I think addressing also the situation that many developing countries find themselves in, such as poor sanitation, and these are the conditions that obviously aid in the spread of polio. Let's talk about that. How does it spread, and how do we address that, and how do we stop it from spreading further?
Yeah, but just to educate the public as well that the polio as an infection can only be prevented by vaccination. Well, poor sanitation can also help in the spread, but I want to reiterate that it's only vaccination that can prevent the spread of polio vaccines to other children, especially children under 5, who are the most vulnerable a segment of the population that can contract the polio virus and polio infection. So this is really a call to improve and increase vaccination coverage, to increase it to at least 95% to prevent the spread of the possible spread of polio infection.
Right. Polio, as I understand it, can polio be cured if you do, in fact, contract it, or once infected? What should we do to minimize its effects on our overall health?
So once you have symptoms, well, the government has its good surveillance system that can detect possible cases of polio, and they should be managed in the hospital, so that and then treated there, so that the child can be rehabilitated in case the child is paralyzed, and they can also live a meaningful life even with a polio case.
Right. Doc, of course, we always say prevention is better than cure. And as you said, vaccination is obviously the key here. How do we avoid polio infection and prevent polio outbreaks? I mean, we remain at risk for this, especially here in the Philippines. Surely, as I think people should understand that it's very simple. We're talking about oral polio vaccines. It's not a big deal to get a shot anymore. You're actually taking an oral vaccine, as I understand it.
Yeah. So the most urgent now is really to do catch-up vaccination, because in the previous pandemic years, there are a lot of children that were not vaccinated. And the polio vaccine, it has been there for the longest time in the vaccination system, the immunization program of the country. So all that the government should do is really to provide more investments in strengthening immunization systems, doing outreaches and catch-up vaccination, as well as strengthening supply chains for polio. And also for mothers, for parents and caregivers to really bring their children who are due for their shots of polio and even other vaccines to the health centers. Because as you know, the polio vaccines, it is safe, it is effective, and they are provided for free in government health facilities.
And really very, very easy to prevent as long as we all do our share. If we do that, I think polio will in fact become history. Doc, we learned a lot from you today. Thank you so much for joining us here on New Day.
Thank you too. Thank you for this opportunity.